Hello, I'm Dr. Bridget Nash, and I'd like to welcome you to The Therapy Show, a podcast series that seeks to demystify mental health treatment. Today, I'm honored to welcome Dr. Judith McCoyd, who is an associate professor at Rutgers School of Social Work and co-author of Grief and Loss Across the Lifespan, a book that seeks to educate mental health clinicians on how to address the needs of someone experiencing grief and loss. She's also the author of Social Work in Health Settings, a comprehensive and insightful analysis of social work practice in healthcare. Dr. McCoyd, welcome to The Therapy Show.
Thanks so much. I'm delighted to be with you again.
I'm so happy you can make time for this interview on such short notice. But I know many in my audience are grieving the loss of loved ones and lifestyle due to the COVID-19 pandemic and can really benefit from your insights.
Hoping I have some insights to offer.
Can you start by telling us a little bit about your background in the field of grief and loss?
I think in many ways, my interest in grief, like for many social workers and other mental health clinicians, started in my childhood. And mine really started with my mother's story of her miscarriage before I was born. I heard over and over how I was not the firstborn, even though I was the first living child. And I heard these stories of her miscarriage and how painful that was for her and how nobody understood her pain and all of that. And heard those stories from my dad as well. So I kind of grew up thinking, wow, there are these really powerful losses that people experience, and yet nobody knows about them. Not as a child, I totally understood that, but clearly as an adult, I can look back and see that. And so, like many of us who try and undo our parents' losses, I thought I was going to be an obstetrician. I went off to college. I was a pre-med major. And as a pre-med, was only interested in obstetrics, of course, because I was going to make that baby come one way or the other. And in doing that, I came across, it's a very long story, but the short version is I came across what at that point was called a medical social worker. And to me, she was the one doing all of the interesting work, going in and talking to women after these different kinds of obstetrical crises. And so I changed my major in college from pre-med biology to being what was called an independent study, biology, social welfare, psychology, and then went off to graduate school in social work. Got my MSW at Columbia and was very lucky to be able to continue my interest in kind of maternal and child health care. And again, really thinking about these losses that are sort of hidden, particularly perinatal losses, which are very kind of quiet, and there's just this tiny club that sort of knows about them. And so I had several years of working in hospitals, both in perinatal settings and oncology settings, and I became even more aware of not just these perinatal losses as sort of a hidden loss, but also in oncology, people who didn't die necessarily, but they lost a limb or they lost a sexual organ, and they had this sense of grieving, but nobody to grieve with. Certainly that was part of what we did in social work with those folks. But I just was really intellectually stimulated by this idea that there's this grief. And we know that with grief, the best way to deal with it is to deal with it with other people. But here were these types of grief that were not being talked about. And so when I finally decided I wanted to do a PhD in the late 90s, I was determined to do my dissertation on what I was thinking of as unvalidated grief, the grief that people have when nobody's there to help them with it. And I thought I was so smart. And then I got off to my PhD program at Bryn Mawr and found out that Kenneth Doka had already gotten there. He had coined the term disenfranchised grief, which really mapped on very well to this idea of unvalidated grief. His is conceptually much more complex.
So can you explain the theory of disenfranchised grief and how it relates to what many people are experiencing during this pandemic?
Sure. And I think you're absolutely right that it really does relate very strongly to what's going on during our COVID-19 pandemic. So let me just give you a little history. Kenneth Doka coined this term, I think in 1989. He has two books, 89 and 2002. And essentially, he hones in on the fact that grief is defined by social norms. And so when the social norms don't allow for grief in certain circumstances, that's where grief becomes disenfranchised or not recognized. And when grief is not recognized, it can't be dealt with by the person who doesn't recognize it necessarily. And it becomes more difficult to elicit support from others. So Doka came up with 5 categories over the course of those 2 books. The first is that the grief where relationship is not recognized. And so his first work was with couples, primarily male couples, during the very beginning of the AIDS epidemic. And what he found were that many times the partner who was the survivor, that grief was, the relationship wasn't recognized. And so they sort of weren't allowed to be part of the grief rituals. And we see that now because we know that many people would love to have memorial services and burials and the kinds of things that they normally would have as part of grief. But when that memorial service happens or that burial happens, only a couple of people can be there. And that means that sometimes those relationships that were less, that aren't direct family, people get pushed out of that space of grieving. So the relationship is not really recognized as important as it is. A second category is the grief where the loss isn't acknowledged by societal norms as legitimate. And I think that really is what captures that idea of perinatal loss that I've talked about before. So typically those kinds of losses would fall into this second category. But now with COVID-19, we have just a myriad of those kinds of losses because we recognize that when people are dying in the hospital, those are major losses. But people are also experiencing everything from wishing for a hug and touch, or missing their graduations from college or graduate school, or even missing their ability to just hop in the car and go out and buy some groceries. Each of those things is a loss, but they're disenfranchised because they seem so minor in the scheme of things. And so that's in some ways kind of quintessential to disenfranchised grief in that people don't feel like they're allowed to have that loss. Doka's fourth category is where the griever is excluded. And it's sort of here in terms of COVID losses, it sort of maps onto the first where the relationship isn't recognized. But historically, where Doka talks about grief where the griever is excluded as including people like children or people with developmental delays who are kind of purposefully excluded from the grieving rituals that people have. But we see the same kind of thing now where, people would normally maybe be buried with 40 or 50 people at the graveside, and now only 5 can be there. And often they have to sit in their cars alone, just watching while the burial takes place, and they aren't part of a service. And so grievers are overtly excluded from the space where they have typically been. And additionally, they're isolated from one another. And that's really pretty key. A fourth category is grief where the circumstances of the death cause stigma or embarrassment. Doka had coined this term really to talk about people who died of HIV/AIDS. And so there was stigma and embarrassment about that. And that category was expanded to cover, for instance, like capital punishment or people who died of drug overdoses. But it's interesting because in some circles, there are now people who even are embarrassed by the diagnosis of COVID-19 itself, even though it's everywhere. People sometimes act as if there's stigma connected to COVID-19, either because they did not protect themselves well enough or because this is an infectious disease and people have sort of an issue about infections. In some circles, this grief does connect to stigma and embarrassment. And his final category is grief that's expressed in non-socially sanctioned kinds of ways. And in his traditional setup, in his categories, he really is talking about people who are very expressive, say crying and that kind of thing in areas that are more stoic, or they're stoic in areas that are expressing a lot of emotion. And that may not seem as directly connected to COVID-19, but I think what we see happening too is that there are places where certain religious rituals are expected, that's what is socially sanctioned. People are supposed to sit Shiva, or people are supposed to have a burial within 24 hours. And again, all of these things are topsy-turvy because Funeral directors are overwhelmed. We can't manage bodies in the same ways that we have in the past because they have COVID-19. And so there are a lot of ways that people are being forced to bury their dead in what they would view as non-socially sanctioned kinds of ways. It does not fit their religious heritage. And so all of these things, all of these types of disenfranchised grief, the way they map onto COVID-19 is to add one more layer of loss, and often a layer of loss that people don't recognize in themselves. I often think about disenfranchised grief not only as these categories that DOCA tells us about and helps us to conceptualize, but also the way that people disenfranchise their own grief. Oh, I can't be upset about that when other people are having overt death. And so I think, I hope that kind of captures disenfranchised grief as the categories, but also particularly the way I see them mapping onto the COVID-19 crisis.
Since so many people are losing loved ones to this virus, I wonder if other people may be sympathetically grieving other losses and may even feel guilty for having those feelings when people are literally dying around them.
Right. Yeah. And I think that's absolutely accurate, that whether it's because they have disenfranchised their own grief, and so they're feeling this, they're sympathetically grieving either the death losses of people they don't even know, or feeling guilty because they are grieving the losses that are in their own life, like some of the ones we just talked about, but not feeling like they're allowed to. That's that self-disenfranchisement that I was talking about. I think that those things are absolutely going on. I think there are two other things that I create that sense of grieving and feeling guilty in the midst of all of this. We know that all losses bring up prior losses. So any new loss kind of reminds you of all of the losses that you had previously. And so when you hear about a neighbor dying of COVID, it sort of brings up, oh yeah, I remember what that was like. You know, that's somebody's parent. I remember when my parent died, or I remember when a friend's parent died. It brings up those prior losses. And if people had very intense losses in their past, that will come up too, because they will end up reworking those prior losses as a result of kind of even thinking about loss. We just as humans have a tendency to reflect, and that's a good thing. Those reflections help us move along and help us work through those losses in a new and different way with a new and different cognitive level of maturity. But it does bring those losses up again. And the additional thing is that losses sort of accumulate. And so as they accumulate, that can sometimes tax people's coping abilities. It makes it harder. And so particularly in terms of these disenfranchised losses, if people don't recognize those losses as part of their heritage, the emotion of them comes up without the cognitive ability to process them. And so we have to be conscious of the way those losses can accumulate, be aware of them. And again, there is that piece that people may feel guilty about mourning the losses they aren't viewing as valid. So when they stifle themselves from being frustrated that they don't get to have a graduation, or they don't get to run off to the store when they realize they're missing an ingredient. Those all are little things, true, but they do have a sense of loss to them. And when we don't get the chance to acknowledge that they are losses and then let them go to some degree, then they just add to that sense of these bigger losses that are sort of all around us. And I guess I just want to say one thing. I was interviewed by a reporter a couple of weeks ago about why it is that people would mourn these numbers of people they don't even know. And I mentioned that whether it was Robin Williams or Kobe Bryant or these celebrities, we don't know them either. But that doesn't mean that as humans, we don't feel connected to other humans. And so, of course, we would be seeing these numbers of people who have died and go like, wow, you know, that many in New Jersey or that many in New York, and say, wow, that could be my mother, my uncle, my whatever. So it will feel close. And those losses are real to us. And that's a good thing because it's part of our humanity. Our humanity binds us together. And that means that when one of us is lost, all of us are lost. And so it makes sense that people are having this sense of mourning, even for people they don't know.
I never thought of it that way, that loss kind of binds us together as humans.
Mm-hmm. I truly believe that.
So what is it about this pandemic that spurs such high levels of grief and anxiety overall?
I think the biggest key, and it really is both grief and anxiety, that there's so much uncertainty and so strong a sense of having no control. So both of those things can lead to anxiety, and together they really add the double whammy. Big uncertainty, having no control. So there's a whole literature in social psychology about how you give people uncertainty and you can brew anxiety disorders. And that's where we are right now. With COVID, we don't know where it's going. Every time we think we have a handle on the information coming out, don't wear a mask, do wear a mask. Will we be able to tell the antibodies afterwards? Oh, nope, we can't really tell that, at least not quite yet. And no, we're done having these surges and waves of illness. And then, nope, here comes another wave of illness. So that level of uncertainty and feeling like there's very little that one can do to take control are going to lead to anxiety. And in that lack of control, of course, people die. And so, of course, there's grief that comes along with those deaths, or even with the loss of being able to be with people as they're in their illness. All of these things are going to impact our levels of grief and anxiety. And of course, they feed into each other so well, trying to figure out how to find predictability in that uncertainty, or finding the places like wearing a mask where we do have some control becomes pretty key.
So because of the transmissibility of the COVID-19 virus, so many people are having to say goodbye to their loved ones at the emergency room door. Since your expertise is in social work and hospital settings, can you talk about the various ways this is impacting people?
Sure. When I was still in hospitals, one of the things that we did the most was to deal with the family. Certainly we were talking with the patients, obviously, but we're working with the family. And now family aren't allowed to come into the hospital at all. It's really quite difficult. And so in many ways, not being able to stay with a loved one as they enter that emergency room door, knowing that that person is scared and having some sort of health crisis, those family members are actually feeling what we talk about as a moral injury, that they are having a sense, I should do this behavior and I may not do that behavior. And we've never really had circumstances like this before. And so I think we have to kind of start with the patient is going in frightened, sick, and feeling very alone. And the family members are being kept at the door and kept out and feeling this sense of moral injury. And I want to make one thing clear, because so this isn't just about people going in with COVID-19. It's anybody going into a hospital. I'm at heart a perinatal social worker, so I'm very aware that there are lots of women, especially in New York, who really are not allowed to have their family members, even their partners, with them while they're giving birth. And people have been referring to that as giving birth alone or dying alone. And I want to make sure that we're clear that we're talking about giving birth without their family members or dying without their family members, both of which are awful, but they're not alone. And I want to recognize that as much as we're recognizing health workers as heroes in lots of other ways, health workers are stepping up and being heroes by accompanying people during these life-changing transitions as well. So health workers are there helping women deliver, keeping them company. They're there while people are dying. They're trying to comfort them. They're trying to use their personal phones to FaceTime with family members. So I want us to just keep in mind that people are definitely apart from their family members, and that's awful. But they're not alone. They do have these pretty heroic health workers. But all of that means that there's this tear in the social fabric. Again, I think we humans need other humans, and we kind of need our humans. And so it's really hard for that patient and very hard for the family as well when they're not able to be there at these life-changing moments. But again, I think it's hard also, obviously, for the health workers, but kudos to them that they are doing the best they can do to try and keep families connected with their patients while they're in the hospital.
What do you think the impact is of not being able to adequately mourn those that have died due to this virus is having on our ability to process these losses?
I guess at first, my first thought in hearing that is like, what is adequately mourn? Because I think that adequately mourning implies that there's an ending. And I want to just kind of problematize that idea a little bit, because in some ways, that almost goes back to some of that stage theory stuff about mourning, that somehow you walk through, 5 stages or some number of stages. And even though those stage theorists have kind of pulled back and said, okay, yeah, the stages don't absolutely go in order, and okay, they can kind of move all around, which kind of takes away the stagedness of stage theory. I really have always thrown stage theories out. They don't really apply to grief for people who have already died. They were really set up to be for people who were dying. That aside, adequately mourning, I think, is again related to social norms. It again ties us back into disenfranchised grief, because there is sort of an expectation of where we're supposed to go somewhere along the way through mourning and coming out the other side. And so one of those expectations is that we grieve with the people who love us and who we love. And in grieving separately, often in separate spaces even, that makes it more challenging, certainly, to adequately mourn. And given that, I think one of the other things that's happening is that, again, I'm kind of putting quotation marks around adequately mourning because it's an important phrase, and yet we want to problematize it. People mourn according to their expectations. They mourn according to their social surround. And so, for instance, for people who would normally bury within 24 hours, observant Orthodox Jews, Muslims, Amish, that burial is supposed to happen within 24 hours, and that's not happening. And so the expectation of the way the beginning of mourning goes is out of sync with what actually happens. So that sets up a bigger challenge for mourning. Additionally, the memorializing of people, the things that come after that burial time, it's also all topsy-turvy in that people can't connect. They can't get those hugs that are so meaningful when you're mourning. The community can't come together. John Bowlby, who is a theorist about attachment, writes how memorializing the dead is a way of recognizing where the deceased fit in that community, and then having the community come together to figure out how it goes on as a community without that person in it. How much more challenging it is to do that piece of mourning when we can't come together. We can have Zoom rooms and we can do all this kind of thing, but it's not the same as sitting, crying together, holding one another, and thinking about how we process those losses, how we remain in community even without that person, how we hold on to the memories of that person and the legacies of that person as we move forward. All of that is much more challenging in an era of COVID-19. And so I believe we are finding ways to do that. We are finding adaptations for our mourning, but it's taking a little while because mourning has kind of these rituals that have been connected with it through our religious communities, through our communities. Even the ones that have evolved more recently are being forced to evolve even more in a very short period of time. So that makes adequately mourning more challenging. And yet I believe we will be able to figure out these adaptations in meaningful ways.
If we look at the pandemic's effect from a developmental perspective, how do you think this pandemic is affecting people at different ages?
Yeah, and it is, right? We know that it is. So one of the things that I'm fascinated by, and you mentioned the text Grief and Loss Across the Lifespan. One of the reasons that my first co-author and I decided to write that text was because people do mourn in different ways at different ages. And we can't kind of treat younger people and middle-aged people and older people like grief is the same. One more problem with stage theory. It can't all apply to everybody at all ages. So children, think about what they're missing right now. They've been pulled from their schools, often from day to day. I was talking to friends whose kids' backpacks are still stuck at school because they thought they were going to be going back there the next day. So their belongings, the things that they hold dear, think about what kids put in their backpacks. Their little favorite toys are down in there. And their teachers and their friends, all of a sudden, they are pulled from that. Even infants and toddlers have lost their daycare providers that they would interact with daily. And they don't necessarily have the ability to quite understand, why is it I'm not doing my normal routine? Why is it I'm not going back and seeing my friends? So I think children are particularly hit because they have such varying abilities to understand from infancy through adolescence, I guess. And one more little story, but I heard doing one of the walks we all get to do now in a neighborhood. And I heard these children yelling across the street to each other. And the one child says, "Come on over." And the two children across the street say, "We're not allowed out of our house. We're not allowed to have play dates anymore." Uh-huh. And I thought, yes, this is hitting everybody in such different ways. But yeah, children are feeling it. Their parents are there on top of them all the time. But I think that's even truer for the adolescents. So adolescents are having a major struggle. I'm seeing this in my private practice. And that makes sense. Developmentally, we know that adolescents are primed to be social. They're primed to be peer involved. And now they're stuck with their parents and their siblings. And so, yes, they're doing lots of screen time. And yes, they're reaching out in many ways across the technologies that they've always reached out with over the last generation or so. But they're being removed from what is required of their maturational stage. This is the time, adolescence is the time that people are supposed to be very peer involved, and they can't be, at least not in a face-to-face kind of way. And they're experiencing that as a pretty major loss. And just kind of growing a person up, thinking about these childhood losses and then the adolescence, we have this new developmental stage of emerging adulthood that Jeffrey Jensen Arnett coined the term in, I guess, 2007, I think. But essentially, these are the people who still have a little bit of adolescent to them and still have and are moving toward young adulthood, but they have not yet been able to become independent or self-sufficient. And so these emerging adults are often kind of working in the gig economy, living with lots of roommates, have a lot of change in their life. Well, guess what? They're not allowed to do any of that right now. And so many of them are ending up having just put their toe out into the independent, self-sufficient world. They have to go back home with their parents again. That, of course, means they've kind of just tasted that independent life and now are having to return home. Major loss. And even as adults, so the young adults who actually have become self-sufficient, they may have jobs that have not been the most secure. They seem to be the people losing their jobs during this pandemic. Even midlife, people are hopefully preparing for retirement by that point, and they're watching everything that they saved toward retirement start to shrink to nothing. And even taking it all the way to the end of, I hate to say end of life, but for older folks, particularly people in continuing care communities, they feel like they're sitting ducks. They are not allowed to leave their apartments, even if they're in independent living. They're not allowed to have visitors come in. And so for all of us who kind of mourn our freedom of going out and being out and about, people who are in continuing care communities and other kinds of senior living are actually having even more of their freedoms sort of removed to keep them safe. And that these are all losses that we aren't really talking about quite as much because, again, death losses seem to take priority, and they obviously are big losses, but all of these developmental losses are happening at the same time. And I think keeping that in mind is going to help us as we move into the future, because we've got to recognize that these losses have affected people and will change the way they experience their maturation.
And I wonder if the elderly or the aging population feel that we've left them behind.
Yeah, I hear that I have a client who's in her 80s, and she has actively resisted moving to a community where she has siblings, and her siblings are not allowed out of their apartments. They may not even walk in the hallways of their independent living facilities because they're being kept safe. And yet my client says, at least I can still walk around the block. I can still go out on my porch. And she looks at her siblings and she feels like they are being left behind. And yeah, I suspect there are many in our elder community who are feeling like they are. I mean, the headline in the Philadelphia Inquirer the other day was sitting ducks about people in particularly skilled nursing facilities where they are totally at the mercy of the healthcare workers who come in, many of whom are working 2 and 3 jobs to make ends meet and who are potentially bringing in exposures as well.
What about the economic losses? How do you think they impact us as well?
I think deeply, right? And I think they also add to that level of fear. So in order to survive, we have to have some kind of economic wherewithal. Generally, that's income. And so with people losing jobs and with people knowing that there any kind of investment stocks and bonds for people who are lucky enough to have those, it's all tanking. And so those economic losses are spurring a lot of fear on a whole lot of different levels. And certainly for people who are just starting out, while the gig economy and people who are doing like Instacart deliveries and that kind of thing they're continuing to work, but they're doing it at a risk to their own health. And so there's this internal, okay, wow, I'm still earning money, not much, but at least I'm still earning money. Wow, knowing, hey, am I putting my life on the line here? So there are those kinds of economic losses at that level. But I think there's also this sense that maybe people feel selfish for focusing on money. Like I talk to people who are losing their retirement accounts and they feeling bad about them losing their retirement accounts, but they also recognize, but at least I'm not losing my life. And so there's this sort of like, again, this self-disenfranchisement of feeling as if, okay, I'm scared about this, but I'm not going to allow myself to actually feel it. I think the other group that I'm really conscious of are people who are just starting out, whether they're graduating from college or whether they're graduating from a degree. And of course, I teach, so not surprising that I'd be thinking about these people. But where are they going to find jobs? I worry for them about what they will find on the other side of their graduation. So even if they mourn the fact that they don't get the graduation ceremony that they may have wished for. I think about a student that I have right now who is a first generation to school at all, higher level education, and she's earning a master's degree. So she didn't just get through college, she got through a master's degree, and yet she can't walk and be the pride of her family for being the first one to go through that level of education. And those are big losses. But in terms of these economic losses, where is she going to find a job? I mean, I'm not saying that to my students, but I am saying that I worry for people who are graduating, because I think like the big economic crisis of 2008, they're going to have a very hard time finding jobs in a market where everything is sort of closed down or just starting to come back to life. One more thing like that, I was reading the New York Times this morning, and in the book section, which is always the first thing I go to, they write about people who have worked so hard to write that first book and that are finally getting the recognition for that first book. And those book rollouts all had to be canceled. And they're not going to get the advertising and visits to bookstores and that kind of thing that would normally come along with a book rollout. And so their books may not take off because they're brand new books and they're brand new authors. And so they may not have those same opportunities. So again, these economic losses are so layered and on so many levels, but they're critical to our living. And so we can't live without money. We're in a capitalistic society. We have to have money to live. And it means that deep fear is legitimate when we worry about these economic life losses.
I realize each person and their loss is unique and may require a tailored treatment approach in an ideal therapeutic setting. But given the fact that many people cannot avail themselves to outpatient therapy due to social distancing measures, do you have any generic advice for people to recognize grief in themselves or others and tips for what they could do to help the healing process?
Great question. I think you're right. All grief is unique. That's why I was kind of saying the stages are false. And yet I think there are things that we can do for ourselves and that we can do to help our friends and family. I think one of the first things, and this seems so basic, but I always think of it and I say to my clients, you have to attend to the infrastructure. So what's the infrastructure? The infrastructure is making sure that you're sleeping well, eating well, exercising, trying to avoid substances, because even though they may help you sleep at first, they destroy your sleep. And so I think that's the first thing, that all of us in this time of uncertainty and grief and lack of control, we have to take control of the things that we can take control of. And that's taking care of our bodies. Got to start there. In terms of grief itself, I think the first thing is making sure that you find somebody with whom you can share the story of the person who died or the entity that you've lost. Maybe you've lost a job or maybe you've lost a person, but you need to be able to talk about that story. Who was the person that you lost or the entity that you lost? What did that mean to you? Review those memories. Find somebody who can help listen and really be interested in that. That's a key piece of processing grief of any sort, having the person who will listen and with whom you can share the story. A third thing that we can do is to really be conscious of how to honor who or what was lost. What did it mean? Can you journal about it or create an artistic work of art of some sort, write a song about it, or somehow memorialize what was lost? And again, I'm trying to keep this general. So it's not just people who die. It's losing jobs, losing a way of life, losing trust, losing relationships. And I think kind of connected with that is thinking about what else was lost as part of the loss. So I talk about this with people who are widowed often. It's not just losing that partner or spouse. What are the other pieces of it? The person who did the checkbook, the person who walked with you, the person who did the vacuuming. What were the pieces of that relationship that are lost? Same thing with a job. Yes, we realize that you lose income when you lose a job, but you also lose your work buddies. You also lose a sense of purpose sometimes. So that next kind of, fourth step sort of is to be thinking about what are these part losses is the way I tend to think of them, or secondary losses to the main loss. And I think it's important to recognize that it doesn't have to be about tears. I mean, sometimes people are tearfully expressive, and that's certainly perfectly fine. It's a very kind of gendered model of grieving. But there has to be some way that people kind of move back and forth. And this is something for people to think about for themselves, that they move back and forth in and out of their grief and thinking about what it means. People often have this myth that they're supposed to do grief work and stay in the grief. And that's not accurate. Strope and Shute tell us that it's really very important to do what they call the dual process model, kind of spend time that they think about the loss and what that means to them, but also do what they talk about as restoration orientation. Think about what will the future hold? What will it be like in moving through life without what was lost? As not to focus on what was lost, but to focus on what will that new life look like? How do I begin to enter that life? I think that relates to one of the kind of the last thing I can think of right now, but the final part of mourning is often moving into that future while holding on to what was lost. And I don't mean holding on to it in exactly the way it was. It has to be transformed, but it means thinking about, if it was a death loss, who was that person to me in the past, and how do I carry on that person's legacy in my future? Or if it's, say, a job or a relationship, what did that job or relationship teach me about who I am, and how will I carry that changed identity into the future? How will I carry kind of the pieces of that loss in its transformed state of who I am into the future? So that's kind of a lot of different steps, but you really start with that infrastructure and you end with, how do I carry what was lost as a new part of me, as part of my history, as I move into a future transformed by this loss?
Do you think we are collectively mourning life as we once knew it?
Absolutely. I think the world has changed. We're both so much smaller, as we're very aware. People travel all over the world, and doing that, we share germs together. But I think the way that we've all had to adjust to, some people call it social distancing, others are insisting on calling it physical distancing, because we don't want to be socially distant. We want to keep our physical distance, but connect with one another. Those things have probably changed us potentially forever. I think if nothing else, we've recognized the frailty of the safety net all around the world and the limits of medicine, that medicine doesn't know everything. It's not magic. It has to learn as we go too. Again, everywhere, even maybe some of the places around the world that we might have idealized in terms of their ability to provide medical care to everybody or that kind of thing, even they have this vulnerability and fear and lack of security. And so I think that those changes are going to affect us for certainly generations to come.
What are any possible gains that we can look forward to as we recover from this collective trauma?
I really love that question, because one of the premises in the book, the Grief and Loss book, is that we grow through grief. Not everybody in all circumstances, but I think the reason that I believe that loss is one of the things that binds humanity is because I think we come out of these losses with some new understanding of ourselves and of ourselves as human beings. And so this question implies that we do that on a bigger level too, that as this really tragic thing has been happening all around the world, that something good can come of it. And I think in some ways we're seeing little pieces of that already. People are more connected to one another. They're setting up these Zoom times with each other on a weekly basis when they took each other for granted and didn't worry about making those connections before. So I think we're going to see stronger connections. Families are having more time together. Yes, they're being forced into it, but I sit at my window doing my work and I see whole families doing their walks together. Never saw that before, ever, ever, ever. I saw mom out walking the dog. I saw dad out on a phone. I'm seeing families constantly. So I think we're going to see growth in family connection as well as these other kinds of stronger connections. I guess my hope is that we're also going to see a recognition of how much we need a strong public health system. And my hope is that all around the world, health systems will grow as a result of this, and public health approaches will be more broadly taken up. I guess I hope that we get new leaders who can be trusted to care for the well-being of people. I really hope that one of the gains that comes out of this is that political leaders of all stripes will not only recognize the need for a good public health system, but will recognize that all people need to have a good, solid safety net, and that security in our health system needs to be there. And I guess my final thought here is that in terms of it's less about the collective trauma and more the result of doing this new way of being in the world. So many of us are working from home if we're lucky enough to keep our jobs. And in doing that, there's a whole lot of headlines in the newspapers about how pollution has been reduced so dramatically. And so I guess it would be great if on top of everything, this time teaches us to be better stewards of our earth and help to reduce climate changes.
So there are gains to the earth. That's incredible.
Isn't that amazing? I hope.
So Dr. McCoyd, on behalf of myself, my listeners, and all of the people that you've helped through your work, I want to thank you for your contributions to mental health treatment and for taking time out of your busy schedule to help me and my audience better understand this COVID-19 pandemic from a grief and loss perspective.
I'm happy to be with you and think about it with you.
So be sure to check out my website, therapyshow.com, which has many resources about mental health, including a page dedicated to grief and loss. There you will also find how to submit any questions, stories, or insights that you have about the mental health system, or suggestions about who else I can interview and how I can improve the show. I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so you, someone you love, and people around the world can gain more benefit from therapy. There's no need to suffer in silence. Get the help that you need to create the life that you want.